It is my honor to introduce Andrea Baccarelli, Dean of the Faculty of the Harvard T.H. School of Public Health. Dr. Baccarelli previously served as a Lyon Hess Professor and Chair of the Department of Environmental Health Sciences at Columbia Mailman School of Public Health. He also served as Director of the NIH Center for Environmental Health and Justice in Northern Manhattan, and as President of the International Society of Environmental Epidemiology. Dr. Baccarelli also previously worked at the Harvard Chan School of Public Health as an associate professor from 2010 through 2016. And now we're very happy that he's back as dean of the school. He's also a distinguished scientist and investigating molecular mechanisms by which a wide array of environmental exposures causes human disease. So thank you, Dr. Baccarelli, for being with us, and please take the podium. Thank you.
Thank you so much. Thank you so much to the team, Luis, everyone, for organizing this fantastic symposium. And one of the disadvantages of not being anymore a full-time scholar, but being a dean, is that you get invited to these amazing events, and you can stay only for a small part of it. But it's really good to be here this time, and what a panel, by the way. Thank you so much for this amazing panel on communication. And at today's symposium, you have wrestled with so many important issues on how do you strengthen health systems globally and health security against a backdrop of a world that seems to be moving in every direction except the ones we would like to see them moving to. How do you engage with the changes in federal policy that seems to diminish the voice of America in global health? And how do you combat misinformation and improve information around the health issue and global health? And I don't have to explain to this room that the challenges are really enormous. It's really a time of incredible challenges, and this is why we have people as amazing as you being together today to create solutions. And it's really interesting that this comes at a time for all of us that where we are creating new ideas and new opportunities. Especially this symposium has generated excellent conversation and true problem solving, both in this room here and online. So I don't know about this year, but I understand this symposium is incredibly popular with hundreds of people connecting from all over the world. I understand last year you had 800 people from 90 countries. And it's really a testament of the vitality and the role of the Harvard Global Health Institute plays in the world. Your mission is to advancing excellence and equity, and to develop solutions to catalyze change. And the model of interdisciplinary collaboration is really a winning model. It's really something that changes what we do. And I have to say, my main message to you is that I'm proud that our school, the Harvard Chan School, can be part of this and can support this program. To that, I wanted to share that I recently been a relatively new dean, a little more than 1 year into the job, that they feel already like 20, I have to say. I'm telling everyone I'm becoming a super dean because what happens the last year really created a lot of experience that I wouldn't have had otherwise. So the vision that I enrolled for our school is a vision that we call the AAA, like AAA rating for a financial institution or a country. And the 3 A's are Agile, accessible, and accountable. And I have to say, I see all these 3 qualities in the Institute. An institute that's agile to tackle the most important issues globally, an institute that is accountable, porous, so that the world can come in and we can be in touch with the world, and accountable to all the people who work with us, and especially accountable to our mission. The mission to make the world a better place, which is the mission that brings together all of Harvard, but especially the mission that makes the Institute and the School of Public Health particularly close. And another thing that really has made me very proud is the new program for visiting research scholars. And I know that you welcome the political scientist from Peru and the bioinformatician from Botswana on campus for 6 weeks. And not only I think these programs are incredibly important, but I have a personal love for this, because the first time I came to this campus was as a visiting scientist about 20 years ago now. And it really changed my life. It changed my career. It created so many ideas for me as an Italian early career scientist visiting Harvard back then. And I hope people also learned a little bit from me, which is the reason for having this type of exchanges, to be completely bidirectional. And of course, it ended up with me at some point being asked to come back as a faculty. That really changed my life for good. And so really proud of this. As something, since I'm the last speaker of the day, I want to make sure you probably already saw this and you were told that the show doesn't end here. Tomorrow, on the back of the program, there is a Harvard Global Health Research Showcase, where starting at 10 a.m., which is for student research. And I looked up some of the students that are presenting tomorrow. One student project considers how a mental health app or apps for mental health could be a cost-effective approach to addressing needs in the global south. Another is about surgical care in China and how people-centered care principle can be implemented to create more equitable outcomes. And the third, pretty intriguing to me, is to explore how whether AI-generated synthetic patients, and I suspected I should know that we can create patients that are synthetic today, but didn't occur to me until today, could be used to democratize access to clinical trials and promote more inclusive medical research. So these projects, in a world where there are a lot of concerns, really give me hope and optimism. And I'm sure they do the same to you. And I hope we will have time tomorrow to congratulate these young scientists and to enjoy their projects. I'd like to close here, and I want to really thank you and congratulate for your commitment to this important, incredible work. And you come from many disciplines, from many backgrounds, and for many nations. We talk a lot about how we are enriched by a diverse community, but really the key point of a diverse community is that you can have people coming together to tackle the same issue, to tackle the same issue we deeply care about, like in this case, equity in global health. It is a privilege to be here. It's a privilege to be here to celebrate, and thank you to all of you for being here, and thank you to Luis and the team for bringing us together today. And I know we have a reception, so I'm ready for it. Thank you.
Thank you, Dean Baccarelli. I think you spoke for everyone. Everybody's probably ready for the reception. I just want to thank everybody so much for spending the day here with us in person in Cambridge. Thank you to everybody online who joined in, shared your comments, your thoughts, your questions. Thanks to the Smith Center team for everything, our AV team, the amazing team at the Harvard Global Health Institute. Thank you so much for putting this together. Our speakers, our engaged audience, you have taken me on a journey today from some despair through worry, through hope, through intrigue, and thinking about what are we going to do in this moment? How are we going to ensure that the people we care about, the patients we care about, the communities we care about, our friends, our neighbors, our families, can be seeing themselves move forward in health is so important and ever so important. And I, for one, am really thrilled to know that I'm in a community like this that is going to persist and that will persist in the face of the challenges ahead of us. So I'm delighted to close out the day. Thank you. And please do join us for those who are here in person at a reception on the other side of the hallway. Thank you so much, everybody.